Today we are going to look at one example of how posture can change and put stress on the spinal structures. Those structures, as we mentioned previously, are predominantly the intervertebral disc, the facet joints, the ligamentous structures and other connective tissues. On this diagram here you will see that the lumbar lordosis, and if you remember that's the curve going inwards, is exaggerated compared to our ideal balance posture. You will also notice that the pelvis, again represented by the green triangle, the front of the pelvis here is significantly lower than the back of the pelvis here, compared to our ideal pelvic position. This pelvis here is in a greater degree of anterior tilt. In this position, the muscles are not in balance, as in our ideal posture, but some muscles are shorter and working harder than other muscles. In this position, the hip flexors are predominantly short and overactive. The spinal extensors are also short and overactive. Whereas our abdominal muscles are relatively long and our gluteal muscles are also relatively long. When we have a short muscle, it tends to be stronger and is working more, and when we have a long muscle, it is relatively weak in relation to the short muscle. Recognizing these postural imbalances is very important when we are deciding which exercises to give patients in relation to their spinal posture. Not all spinal exercises are good for different types of posture. It is important in this example, where there is an increased curve or lordosis in the lower lumbar spine, that we stretch some of the short muscles and work some of the relatively long muscles in order to retrain them.